Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help and discuss journeys and experiences from experienced medical practitioners. And today we are here to discuss a very special topic, discussing stress for NEET PG. As you all know, it's just 1 month left for the NEET PG examinations. There are, every student who is preparing goes through a different kind of mental stress, emotional, physical, all kinds of, different emotions going on. And for this, we have a very special guest, Dr. Siddharth Shekhar Mishra. He is a very well-known PSM teacher who is guiding students day in and day out for their examinations. And he's here joining us to help us understand, how can students get over the kind of stress and different kinds of feelings that they have in this preparations. So welcome, Doctor, to the platform. It's really nice to have you here.
Yeah, good evening, Dr. Ayushi, and good evening, all the listeners over there. The reason probably me and Dr. Ayushi are discussing on stress, probably the moment you guys would see the logo, you will think a psychiatrist probably speaking across, but we are not into that because WHO in the year 2017 had given a theme for the World Health Day that was Depression, Let's Talk, rather than depression, let's treat. And that holds true for every stress related issues. So any form of stress, whether it be exam stress also, it's let's talk, it's not let's treat. And that's the reason probably Dr. Ayushi and me are probably going to discuss some things what we have also gone through and experiences shared by other young doctors with us on this forum.
Correct. So, as sir, you have also been in that phase of preparing NEET PG, and now I'm sure you're seeing so many, students doing that. What do you think is the is the thing that students should take care of while preparing their examination? How should they go forward, especially in this last 1 month? Because there is so much of syllabus to cover, and how should they go forward so that they just relax and cover everything?
See, Aisha, actually, if you see the way the exam pattern has changed,
Hmm.
NEET PG is now slowly becoming more like a next exam.
Hmm.
So if you understand the next pattern which is being proposed is like they would have three papers. One paper will be surgery, one paper will be medicine, one paper will be OBGY. And with that, we'll have papers. The second paper in the afternoon will be for ENT, pediatrics, and ophthalmology.
Hmm.
PSM will be 10% of the
Hmm.
entire one, and all the first and second year subjects will be 10%.
Hmm.
Now, if we see the NEET paper for last 3 years, since
Hmm.
this initial announcement had come, the
Hmm.
NEET paper is also following such kind of pattern. If you
Hmm.
see medicine, surgery, OBGY, and PSM, four
Hmm.
subjects are making up almost 100 questions of the paper out
Hmm.
of 200.
Hmm.
So this is the first message which I would like to give all of the students over here is, if I am planning a revision cycle in this 1 month, I'll
Hmm.
first try to master revision of these four subjects.
Hmm.
Because if
Hmm.
out of 100 I'm able to score 90 or 95, my job is done.
Hmm.
Because the
Hmm.
rest 100 is covered by 15 subjects.
Hmm.
And
Hmm.
out of this 15 also, ENT, Ophtha, and Pediatrics are roughly giving me 10 questions each,
Correct.
making it 130. So
Hmm.
once I'm done with the revision of these four, I'll go for the next three.
Hmm.
So
Hmm.
this is a way of staggered revision I would be doing probably for my preparation in this month. Second,
Hmm.
I would never read anything new
Hmm.
because it is about a revision. See,
Hmm.
I understand I might have left forensic, you might have left biochemistry, but see, it is a battle of equals. I am not competing with a forensic faculty, or you are not competing with a biochemistry faculty. You are competing with me if you are
Hmm.
my colleague in the exam, and I am competing with you.
Hmm.
So that is where I feel, do not have the fear of missing out. Even the rank one does not score 200 out of 200. The
Hmm.
rank one currently in Indian context is roughly scoring 175 effective correct. That
Hmm.
means he or she scores around 180 odd and gets 15 questions wrong to make it as 175.
Hmm.
So do not be in the fear that this is left, that is left. No, let's not think like that. Let's strengthen what we know.
Hmm. Hmm.
So that is the second point I will say for this month.
Hmm.
Third, in this month, forget that the risk of failure. See, trust me, what worse can happen to a student? I won't qualify, that's all. But what great can happen to me? I'll definitely qualify with a very good rank. But the time I'm spending in thinking that I won't qualify is actually leading me to a negativity and actually leading me to a zone where actually I might not qualify. So rather than going into that negative frame of mind, why not I think, yes, boss, man nahi to aur kaun? That popular rap singer. Yes, that's how probably I would tell myself in my mind. That's how I would basically think in this 1 month. Fourth, health. See, we always talk about mental health, but there is also a component of physical health which we actually miss out in this month, and that is first is irregular sleep cycles. See, try to understand. We are humans. I need minimum 6 hours of sleep in the night, which is undisturbed, and in the daytime probably even 60 minutes of rest, because I cannot expect my mind to work for 18 hours. So I would prefer to give it a rest. Second, I generally tell my students, we are not dogs कि जब भी देखो चाय और बिस्किट खाते रहते हैं. So see, it can be a snack, but it cannot fill your stomach. So I would suggest all of you guys is this month, please do not go for dieting thinking that, okay, I would not take it. Have a good food, which is less oily so that it does not give you a unrest when you're sitting for a long time. So that is another physical aspect which you should think. Take a bath. Trust me, it might seem very funny, but many of us do not take a bath thinking it's a wastage of time during preparation. No, it gives you a freshness, and it's a reality. When water pours on our forehead, our brain starts working more, and that's the reason we have a habit of combing, putting oil. Everything counts. So just follow a routine. Let's say I wake up every day at 7. I start studying from 7:30. 7:30 to 10:30 I studied. 10:30 to 11 I had a break where I had the breakfast. 11 to 2 again I studied. 2 to 3 I did my lunch and revised something. 3 o'clock I just took a nap till 4. Again 4 to 7 I studied. 7 to 7:30 I had a break. Then probably 7:30 to 10:30 I studied. 10:30 to 11 I had dinner. Things like this. So I would say follow a schedule, because the moment you start following a schedule, things become very easy. So this is the fourth message I would like to give you, what should be done in this particular month. And the last message probably is stay away from people who tell you, beta tumse nahi hoga. Trust me, I can't do. That can't and can, there's only one difference, and that is that apostrophe. We write na can't, C-A-N, and apostrophe and T. See, trust that apostrophe is the person who feeds in your mind that you can't do. So just do not listen to people like this. There are many uncle aunties around. Your relatives might be saying ki I saw XYZ guy putting so much of effort, could not do this, that. Fine, that's fine. But let us say that we can do. Let's give our best. Let's make the day fruitful. Why should I think that a Bollywood movie will only be a blockbuster? We could see last year that we had movie from the southern part of our country where they broke the language barriers, and because they had the quality, and they become national, international blockbusters. So it is the quality of the movie, it is not the language. Similarly, it is the quality of the individual. It is not about what is the norm. Let's not set norms like that. This is probably the fifth message I'll give for this 1 month probably.
Very nicely put down, sir. So now when you mentioned about all of these, very important points, there are also some questions that are, that are always going on in the mind, since the last 2-3 years, there have been postponement of the examinations. Still now, even if, kids are preparing, there is one or the other person who comes to you and say, ki, "Arey, postpone ho jayega exam. Ye to normal hai, government to kar degi." So how to just stay away from that kind of thought and stay focused?
See, in this, I got a very simple explanation. Suppose you are the rank 1 person in this exam, and I am the rank 1000. Suppose the exam is postponed for 21 days. It is postponed for me also and you also.
Correct.
So in the next 21 days, you will be reading the way you were reading. So you will be the rank 1 only, and I would be the rank 1000 only. It is not going to make any difference to me. But imagine I am the guy who's ranked 1000, and I just keep on thinking that boss, postpone hoga. I will become rank 1000 to 10,000, and then 10,000 to 1 lakh. But you, the person who is rank 1, is telling yourself very clearly whether the exam is on 5th March, 5th April, or 5th May, or 5th June, any 5th. I am going to be the rank one. That's all what I know. So for
Hmm.
postponement, I will say if you are seriously preparing, forget it. The day the exam will be there, whether it be on 5th March or 5th May or 5th April, you are going to rock if you have prepared well. So just
Hmm.
focus on that.
Just focus. Stay on course, basically. So there is also, one more doubt that kids have, always कि मैं आई एम अ फ्रेशर राइट नाउ मेरे को इतना टाइम ही नहीं मिला है प्रिपरेशन करने का जस्ट अभी इंटर्नशिप खत्म हुई है पीपल हु आर प्रिपेयरिंग फॉर ईयर्स नाउ 1 साल 2 साल से प्रिपेयर कर रहे हैं हाउ विल आई compete with them or then there are people who are like कि you know freshers are at par because उनकी सारी knowledge fresh होता है and they are studying continuously and I didn't clear a day last year also और अब तो पूरा examination process ही change हो गया है पूरा examination pattern change हो गया है how am I at par with them whether I will be do better than them or not what do you think on that thought process.
If you ever have got a chance to see a cricket match, you will see in a cricket match there are 11 players.
Hmm.
So each player has got their own years of experience. Now, if you
Hmm.
look into the current Indian team, the openers are Shubman Gill and Rohit Sharma. Rohit Sharma is a person who has probably the highest individual score, 264.
Hmm.
Whereas recently, Shubman Gill became the youngest player to score a double century.
Yes. Hmm.
Now, the interesting thing is what matters is that day who
Hmm.
will score the double century. It does not matter if you're a fresher like Shubman Gill, who never scored a double century, or you are Rohit Sharma, who has the experience of scoring the double century.
Hmm.
But what matters is what is the process. See, the process is very simple. For a cricketer, the ball comes, you have to hit it so
Hmm.
that the ball goes to the boundary and you
Hmm.
get a 4 or a 6.
Hmm.
In medical science, it is very simple. You will get an MCQ, you have to hit the right answer. Now, to
Hmm.
hit the right answer, you should have a proper concept. And that concept should be learned without fear.
Hmm.
You
Hmm.
cannot expect that you will learn delivery on a mannequin. Normally, in final year, we get a pelvis and a doll and we start explaining, okay, see, this is
Hmm.
how the 9 steps of labor
Hmm.
happen.
Hmm.
But those people who have actually been in a labor room, they know there are no 9 steps. When the baby comes out, the baby comes out. We don't
Hmm.
start, okay, अभी तो step 3 हुआ है, खा लेते हैं, अभी और 6
Hmm.
बाकी है.
Hmm.
ऐसा बिल्कुल भी नहीं है.
Hmm.
It's a real time phenomenon. So that experience or that practice is unmatched. So
Hmm.
whether you're a fresher or a experienced guy of a year of dropping out or 2 years, trust me, this is a fresh exam. Like a cricket match, if Kohli scored 100 in last match, the score for this match will start at zero. And if Kohli scored a duck in the last match, the score for this match will start at a zero. The
Hmm.
exam is just like that. Year 2023 NEET exam, the score for is zero for all. So the person who will score the maximum runs will be the highest run getter. So that's how it works even in the entrance exam.
This is a very nice way to see it and to go forward with it. So there is another one more mindset a person has after MBBS. Everybody thinks अगर PG नहीं हुआ तो there will be there's nothing left in life. आजकल तो लोग super specializations दे रहे हैं. Post graduation is at least the minimum I should do. What do you suggest for those people who are in that struggle and maybe have not cleared for an year or two and are still struggling? What do you suggest with them?
See, Ayushi, I'll tell you a very nice experience. Long back when I was an intern, me and my friend, it was a scorching summer, and we were having a bike at that time. We were
Hmm.
going, and we stopped at a sugarcane roadside
Hmm.
shop. Okay, so this guy is wearing just a torn banyan and is giving sugarcane juice. And the glass of juice was 10 rupees. He
Hmm.
gave us, and there was a huge smile on his face.
Hmm.
Me and my friends who were already MBBS doctors, we were under a lot of stress because we were preparing for the exam.
Hmm.
I told my friend that, buddy, you look at this guy, he does not have a proper place, but he
Hmm.
still is content. He's
Hmm.
content with his life.
That's true.
My friend told me, yes, I agree to you that the
Hmm.
contention is the right thing, but I am not content with being an MBBS.
Hmm.
Okay. Now, see, this is where I would tell my flight of thoughts.
Hmm.
The first thing is the art of being content
Hmm.
is to be content in the present. I'm
Hmm.
not talking about the future
Hmm.
because I do not know my future.
Hmm.
We all used to say that Rishabh Pant is the youngest keeper doing so well, but unfortunately, he met with an accident. He never knew it.
Hmm.
And now, unfortunately, he being the most talented player who performed so well in the Border Gavaskar Trophy in Australia is unable to be a part of it. But I know a couple of years later, when he will come back stronger.
Hmm.
You know, the same is with PG exam. See, PG is a part of life. It is not life.
Hmm.
Life is a very big thing.
Hmm.
Trust me, if you see today, even the people who are doing PG, they are not happy. They say there is so much of stress, we want to resign, we want to quit.
Hmm.
If it would have been a happiness just doing a PG, then the day I would have got PG, I would have been the happiest person. Then why are we seeing people with stress? Because it is about how you take the things. Whether
Hmm.
you are content with the present.
Hmm.
So I am content with today that I am an MBBS boss. Fifth, I'm going to give the exam and I'm going to make a jump.
Hmm.
If I make a jump this year, I'm going to join a residency and I will be content with whichever subject I get because I gave my best. That's what I have to tell
Hmm.
myself.
Hmm.
Suppose I don't get, there are ways, but I'm not thinking about that for these 30 days. I'm telling myself that these 30 days are going to be the best 30 days of my life. That's all
Hmm.
what I want me as a candidate to think. See, it's
Hmm.
very simple. What I think, I'm going to behave like that. The way I behave, I'm going to perform like that. So if I continuously start doubting myself, trust me, I would not be able to perform. And that is what even happens when we drive a car.
Hmm.
You would have seen the person who drives a car for the very first time generally will drive at a speed of 10.
Hmm.
When we become a chronic driver, probably we can drive even at a speed of 90, 80,
Hmm.
100. That happens.
Hmm.
So same is with studies. Let's not have that fear that अगर PG नहीं हुआ तो देखा जाएगा. We will see what we'll do, but we'll give the best. Because
Hmm.
if I just think मेरा PG हो जाए, मेरा PG हो जाए, मेरा PG हो जाए, that's not going to sort out my purpose. I have to perform. That's all.
Hmm. That's a very big thing that you mentioned, that you should think the way you want it and you will definitely go through that. So as you mentioned, sir, how can kids be, physically and mentally sane in these times? What is it, in last few words, and that you want to mention for all those students who are appearing this year with the completely changed examination pattern and completely new things coming in, something from your end that to address each and every student of those?
Only thing I would like to tell you is give 30 minutes per day to yourself. Something what you like to do. Okay. Do not see a web series because generally web series are very addictive, especially Big Boss.
Yes.
I'm not against the show that tomorrow Salman Khan might land me into a show. It's not that. But as of now, stay away from a web series because they are generally a continuum, which
Hmm.
takes a lot of time.
Hmm.
30 minutes per day, do what you like. Like when I was a student, I used to actually prefer to go out of my room and go to a fixed stall who used to sell dahi bara.
Hmm.
And I used to like that. I used to cherish that. So I used to make a point that I'll finish up my target. And it used to take me like roughly 30 minutes to go and come back and to have one plate of dahi bara over there. So I used to ensure that that is my like an gift or a prize for completing the target. If I
Hmm.
don't complete the target, I don't get the dahi bara.
Hmm.
That's how I had made myself. Similarly, one of my friends was there who used to be an excellent dancer. So he used to play for 30 minutes some song and he used to just dance.
Hmm.
And generally we feel if we dance, we'll be tired. No, it used to give him that more a kick. That
Energy.
boss, now
Hmm.
I would perform better.
Hmm.
Similarly, one of my friends was a gym freak. So he used to make sure that even during the time of preparation, he will hit the gym for 30 minutes in the morning and the afternoon or in the
Hmm.
evening.
Hmm.
So all of us have some kind of hobbies. Now,
Hmm.
generally, doctors say, "Sir, we don't have a hobby because
Yes.
we were always with books."
Hmm.
Trust me, just staying away from the books for 30 minutes and just thinking how beautiful life is.
Hmm.
Just think why you became a doctor.
Hmm.
Just think how many people you made jealous when you became a doctor.
Hmm.
Just think how beautiful the life will be the day you will become probably an obstetrician and you will be able to treat an infertile
Hmm.
mother.
Hmm.
You will say that congratulations, you are pregnant and 9 months later you deliver. Think
Hmm.
you are a surgeon and you are able to remove a tumor mass. Think you are
Hmm.
a pediatrician and a child who is dying, you're able to save the child. That pleasure, just think for 30 minutes. That will give you a push.
That's true. That's
I'll tell you a nice thing. Being a public health specialist, generally we say that public health interventions are something which show action only after someone's lifetime. Like we recognize the value of Jon Snow a very long time later, or
true.
even we understand that in the Indian context, we have the iodine deficiency in Himachal.
Hmm.
That was proved by Dr. Ramalinga Swami, under whose name we have the auditorium also at AIIMS, after his death. And the
Yes.
same happened this time for ORS as well. If you
Hmm.
know, for ORS, this year, posthumous national award has been provided to Dr. Dilip after his death. So
Hmm.
this might happen, but you just think probably I am alive or Dr. Ayushi, you are alive because he discovered the ORS. Otherwise, we might not have been alive. We
That's
might
true.
have been dead with
Yeah.
diarrhea. So
Yeah.
this is what our profession gives us. So let's
Hmm.
smile for our profession. See, I have a phone. If this phone is not going to work, I go to a service center, give the phone. The person will say, you replace the phone. But
Hmm.
this cannot happen that I tell Dr. Ayushi's parents that Ayushi is not doing well. You replace Dr. Ayushi, get a new daughter. It
Yeah.
is not possible. So
That's true.
this is the charm of our profession. So let's appreciate that. And
Yes.
trust me, if you just feel it from your heart, you are going to be a postgrad. It might happen in 2023. It might not happen. But the reason of not happening is probably because you're just thinking negative. So just
Hmm.
give your best. Give 30 days your best. And trust me, you would be a far better person. Because on 5th of May at 1:30, at 1 o'clock when the exam gets over, and in the next 30 minutes, you should not sit and say, boss, I could have done something better. Just tell yourself, I gave my best. Whatever be the result, I could not have done it better. So my
Hmm.
take home message is just give your best so that you do not say काश हम कुछ ज्यादा बेहतर कर पाते.
Hmm.
वो line we should not be using. That's probably what I would like to tell to all the youngsters.
That's true. That's true. Now, you
Hmm.
ended it so well, sir, and very correctly said. It's just you have to feel it from inside. You have to believe in it to achieve it. Is what I take away from what Dr. Siddharth says, and I'm pretty sure all of the students who are listening to you are equally motivated to understand the whole, how to think, how to behave, and how to take care of yourself during this process. So thank you so much, Dr. Siddharth, for being with us. Thank you so much for guiding each and every student out there, and as well as helping them on an everyday basis with what you are doing. It's I'm pretty sure everybody, and me as well, we are so grateful to have you as a teacher here.
Same
Thank you
here.
so much, sir.
Thank you.
Thank you.